In the early 20th century, mental hospitals and asylums were America's mental health solution. The operative phrase was, "They were put away." Committing someone was arbitrary and could be initiated by family, physicians, police, courts, or social workers. People were often committed against their will, without due process or the right to appeal. By 1950, there were 500,000 patients in more than 250 institutions. Admissions were streamlined. Discharges were rare and often had setbacks with patient readmissions. It was a revolving door. With no help or support services, most became institutionalized. It was typically a life sentence or a death sentence. Patients were dying at alarming rates and were buried in graves on the hospital land or in catacombs. One asylum had 25,000 unmarked graves. Patient treatments included insulin injections, shock therapy, lobotomies, sterilizations, brain surgeries, and large doses of sedation drugs. Many patients were kept in padded cells to minimize homicide, suicide, and assaults. The only noticeable change was more and more patients. Overcrowding justified more asylums. By 1930, 33% of New York State's total budget was to pay for the building of more mental institutions. This is the story of a mental health hero. Dr. Abraham Lowe was the American neuropsychiatrist that first called the elephant in the room. Hospital containments are not curative for mental patients, and psychoanalysis does very little to help. Dr. Lowe started immediately to work with his most chronic patients. His goal was to design and develop a method that would provide them actual relief. Dr. Lowe's new recovery method was revolutionary because A, it actually worked. Patients stopped suffering. Now they knew what to do. It was a self-help path to real normalcy and functionality. B, it shifted the focused solution to a new patient's self-management and their support groups. And C, it was quickly scalable and affordable. It could be taught by trained lay volunteer leaders to anyone. Dr. Lowe published Mental Health Through Will Training. It is the definitive textbook that recovery groups study today. Recovery groups everywhere showed positive results. Dr. Lowe's method was the origin and launch of peer-led group support and cognitive behavioral training. The Saturday Evening Post's famous columnist Jack Alexander wrote a feature article showcasing recovery's method. It helped generate awareness and, with many testimonials, provided new hope for anyone with mental health symptoms. Dr. Lowe passed away in 1954. Recovery Incorporated continued expanding meetings and awareness. His devoted family created a lasting infrastructure that formally became Recovery International in 2007. Recovery International is devoted to easy meeting access and support. It is structured for consistent quality and results. The mission of Recovery International is to use the cognitive behavioral, peer-to-peer, self-help training system developed by Dr. Abraham Lowe, medical doctor, to help individuals gain skills to lead more peaceful and productive lives. Join us at recoveryinternational.org and make a difference in your life today. Thank you for watching our video Mental Health Hero.